This is the clavicle. It is the only bony attachment between the trunk, the body, and the upper limb. In fact, if this bone to be fractured, the patient would come to you carrying his upper limb or by his other hand or arm. An indication that this, though it's a small bone, but it serves a very important function as it transmits the body weight, I mean the weight of the upper limb to the sternum to be transmitted to the trunk. So this bone has a two surfaces. This is the superior surface, and this is the inferior surface, and immediately you can see that the inferior surface has to it rough areas here and there, as you can see, while the superior surface is smooth, almost smooth. It has two ends, one of them medial, and let's focus on this one here. The medial end is bulky, while the lateral end is flattened, as you can see here. Bulky, flat, okay. And we do have two borders. In the anatomical position here, we have, this is the anterior border, and this is the posterior border. Now, what is interesting about this bone is the following, that each, it has two ends, two surfaces, two borders, but the ends are totally different from each other, and this enables you to know which one is which. The bulky, huge one here is the medial end. The small and flat, relatively, the lateral one. We call this sternal end as it is attached to the sternum, and it forms the sternoclavicular joint. And this one is attached to the acromion of the scapula, here to the acromion of the scapula, and it forms acromioclavicular joint. We also have two different surfaces. The posterior one, the inferior one is rough due to the attachment at least of subclavius muscle, and of course other ligaments to stabilize the joints on two ends of the clavicle. Also, we have the superior surface almost smooth, so we can also differentiate between them. What is also interesting is the shape of the borders. The anterior border medially is convex and laterally it is concave, and the posterior, as you can see here, the posterior end, posterior border is concave, and the medial end, and the lateral end here is convex. Of course, some textbook they write concave anteriorly, convex posteriorly when they're referring to these different parts. What should be important here, that the part that is attached to the bulky medial end is convex. Why? Because behind it here, very important structures, the brachial plexus, are passing. And this makes the shape of the upper part of the thorax, where you see the clavicle, and it is, by the way, subcutaneous bone. You can feel it from the medial end until we reach the lateral uh, end. Now let's put the clavicle to its uh, correct side. What do you think? This one is right or left? For me and you to determine this, we need to identify three dimensions. Medial from lateral. How on earth you know that this is the medial? Because it's bulky and the lateral is flattened. We also need to determine anterior from posterior. We know that the anterior border is medially convex, laterally concave, and so this seems correct for me. And of course, the last thing is the surface. The superior surface should be smooth, as you can see, and the inferior surface is rough. So I've got it right for the all three dimensions, and this for me seems to be the left clavicle. Now, if you put it to this side, you see that the this end is concave. It should be if had this been the medial end, of course. Uh, so of course we can put it this way. It's wrong. So you can put it this way. I mean, it's correct. The medial end here is correct, but the surfaces are not correct. The two borders are correct as well. So always you need to know three dimensions. Now, what do you think? What is this one here? This one should be the right one. Medial end, bulky. The superior surface is smooth. The inferior is rough. This is the acromion.